Patients suffering from chronic respiratory diseases often don't know where to turn for credible information on their condition. They're increasingly relying on untrustworthy sources such as Wikipedia and Dr Google. And this information is often inaccurate, it's misleading, and sometimes it's downright dangerous. So to counter this misinformation, EUFOREA will launch its patient education platform at the beginning of 2025. The aim to empower patients by providing them with accurate, detailed, comprehensive and relevant information and resources on asthma, chronic sinus disease, COPD and respiratory allergies. This is EUFOREA News. Hello and welcome to EUFOREA News. I'm Dr. David Bull. When patients are diagnosed with a chronic respiratory disease like asthma, COPD or chronic sinus disease, it is incredibly difficult for them to disentangle credible information from false and spurious sources. There is no doubt this means there is a huge unmet need for these patients. Well, as a result, of course, the patients are desperate to know more about the etiology and likely progression of their disease. They're keen to understand the impact the disease will have on their life and how they can manage it to the best of their ability, including prevention and lifestyle measures. The EUFOREA Patient Advisory Board members felt the lack of trustworthy information on their medical condition represented the major unmet need, which needed to be addressed by EUFOREA. That is why EUFOREA will launch its patient education portal on the 31st of January 2025 as part of its Airways Disease Action Plan for Personalised and Predictive Treatment, or ADAPT. Well, here to explain some of the challenges that patients experience is Dr. Catherine Shire. She is a CRSWMP patient. She's also EUFOREA's Patient Advisory Board co-chair. Really good to talk to you once again, Catherine. Let's start talking about the moment that you were diagnosed. There must have been issues that you faced as a patient, but you're also a doctor by training. What sort of information were you desperate to get hold of?
Question I wanted answering was, what is causing all my problems, and what can I do to help myself and to prevent future problems, prevent it getting worse. So I wasn't really given any information, and I was just told, well, you've got nasal polyps and chronic sinusitis and you need surgery, and that was the end of it.
And that must have been extraordinary for you, the role reversal, going from being a physician to becoming a patient and suddenly finding yourself in this vacuum of information.
Yes, it was really frustrating. So I understood the reason that I needed surgery, but what was driving me mad was, how could I help myself and prevent, even if I had surgery, I couldn't see that it was going to prevent it from getting worse again. I thought the problems are just going to recur, and I don't want to have recurrent surgery. And I've also got chronic asthma, which became worse at a similar time. And I thought the surgery is not necessarily going to help my asthma. So I wanted to understand what the underlying process was that was causing this, and what I could do to help myself as much as anything, to help my symptoms and to try and prevent the problems becoming worse in the future. So, as we all do, I turned to Dr. Google, and as I tell my patients not to, and I found EUFOREA, which was so helpful. There was so much information there, which I wasn't able to get from any of the professionals that I'd seen.
I think that's hilarious. You turned to Dr. Google, exactly what we tell patients not to do. When you did turn to Dr. Google, how comfortable were you with the reliability and the accuracy of the information that you found as a result of that, setting aside EUFOREA?
Having a little bit of understanding was helpful, because I was able to choose the websites that I looked at. There was all sorts of things on there that wasn't particularly helpful, particularly patient forums where everybody was complaining about their symptoms. And it just made me realise how many other people out there have similar problems and how frustrated they were that they weren't being able to get the help they needed. So the websites I looked at were quite helpful, but it didn't help me to access any better treatment for myself.
So what do you believe are the biggest challenges for patients then in terms of trying to understand their condition?
Having access to information, really. And so many doctors and other healthcare professionals just don't have the knowledge and don't have awareness. And what is available online is very limited and very hit and miss. So, there is some good information and there is also some not so good information there. But I think the most frustrating thing for an awful lot of patients is the lack of knowledge and understanding in the healthcare professionals. A lot of patients that you talk to have just been dismissed, saying, well, you've just got a runny nose. It's very common. Lots of people have that. And it's not the patient, the burden of the symptoms and how severe they can be and the chronicity of them is just not understood by an awful lot of primary care physicians, particularly. And there's a lack of knowledge, and as a result, there's a lack of correct diagnosis and treatment and referral. So some patients have to wait for ages to be referred to see a specialist. Once they've seen that specialist, they still don't necessarily get a better understanding. They may be told that they have to have surgery, which can help to some extent, and it's great for some patients, but an awful lot of patients keep having to have repeat surgery.
And I assume that this lack of information feeds back to patients and they feel increasingly frustrated with the system and not being able to get the information they want, and therefore they can't manage their nasal polyp syndrome appropriately.
Absolutely. I mean, even simple things like the importance of nasal rinses, regular nasal rinses, it's not commonly known that how helpful that is. And it's such a simple, inexpensive thing that you can do yourself at home. And an awful lot of patients just aren't made aware of that because the primary care professionals aren't aware of it themselves.
Now, you're the co-chair of the Patient Advisory Board, which has contributed to the development of the patient portal alongside input from physicians as well. Why do you believe that both sources, that is the patient and physicians, are important in the development of this tool?
Having seen things from both sides, it makes you aware that there's an awful lot that I wasn't aware of as a primary care physician about the condition, both in terms of how the burden of the symptoms, the impact it has on your well-being, and it affecting your mental health and your quality of life. So it's important. The physicians also follow guidelines, and you're expected to fit into that box, but everyone's individual. It's not a one size fits all.
Catherine, really good to talk to you. Thank you very much indeed. That's Dr. Catherine Shire there.
Pleasure. Thank you very much.
Well, let's now talk to Dr. Zander Bertals. He is the coordinator of EUFOREA's Patient Advisory Board. He's also the advocacy manager at EUFOREA. Really good to talk to you, Zander. Now, when you developed this patient portal and you then talked to all of the stakeholders involved, it was therefore clear to you that there was a big unmet need that patients were crying out for. What did you find?
Yes, that's totally right, David. So we talked to all stakeholders, GPs, pharmacists, subspecialty medicine specialists, so ENT surgeons, allergologists, pneumologists, pediatricians. We talk to health policymakers, industry, and most importantly, our patients, of course. And when you connect the dots and mainly listen to the patient voice in all the story, they really find several unmet needs. So on the one hand, there's an underestimation of the disease, an under-recognition of the disease and its impact on the daily life of these patients. There is a lack of coordinated care pathways. So the disease journey that these patients need to go through is too long and too inefficient. So that needs to be addressed. There is, of course, also limited treatment options, although there's lots of research going on. And then finally, indeed, there's the need for reliable patient sources that can empower these patients to reduce that disease journey and to improve the whole care pathway. And that is exactly what led us to develop the patient portal.
Were you surprised at what you found?
Absolutely. It's always surprising to hear the impact of the disease on patients, on really their daily life. So when you're in a consultation, you have 15 minutes to talk to a patient. There's, of course, a sort of a structure to that time period that you spend with a patient. That is the case for specialists. That is the case in a pharmacy or at the GP visit. But when you take the time and really listen to the patients and allow them to raise their concerns and things that they struggle with in daily life, beyond that, it's really surprising, and it impacts their complete life.
I was talking to Catherine Shah earlier, and she was saying pretty much what you were saying, that there was this desperate lack of information, that it didn't really matter where she'd turned, she couldn't find the information she wanted. Now, clearly it's important to have a credible portal, a credible source of information. Why do you think EUFOREA is ideally positioned to offer that?
It has to do with the way EUFOREA is structured. So we have our own patient advisory board, which counts almost 75 patients. And these are patients with different type of profiles. We have people with a mono disease, just, for example, only chronic rhinosinusitis, let's say without nasal polyps. And then we also have patients who have multimorbid disease, such as asthma and nasal polyp syndrome. And these are, well, a whole collection of people coming together. And the diversity of the answers and the things we discuss in our patient advisory board, I think, is unique. And because we're a non-profit organization and we work together with academic experts, I think that is the second point why EUFOREA is uniquely positioned here. We have around 50 experts, and these experts cover upper and lower airway diseases, which is also unique. And combining that, I think, gives us the ammunition to start such a, let's say, venture and develop a patient portal and really have the direct input of both parties. And I think that is crucial.
And do you think it sets you apart from other educational platforms then?
Absolutely. Yeah, I think most educational platforms are too complex. Because the terminology that they use is actually too complex for the average patient and their surroundings to understand that, or it is let's say focused on only one disease. And the goal with EUFOREA is really to combine that. And a lot of these patients with airway diseases can have both upper and lower airway diseases. There is a whole scientific hypothesis on this, on the global or the United Airways. And I think addressing that, and that mainly, comes with the fact that we have those different expert panels on different diseases and a really diverse set of patients. I think that really makes the platform unique.
So pulling together all of that information is an enormous task. How did you go about integrating those expert insights, the patient stories, everything together into that portal? What was the mechanism behind how you did that?
Yeah, we work with, let's say, several modules in which we explain the disease more in general and then focus on specific topics, on the symptoms, on the treatment, on lifestyle and prevention. On how to prepare for a doctor's visit. And I think by doing it like that, you can sort of integrate different complexities into it. Like in most modules, we try to be as well inclusive as possible in terms of language, and really having lay language sort of structure and yeah, the possibility for the surroundings, the family, friends, partners, to also look the disease up and understand what it's about. And then we have more very specific questions where we can be more comprehensive. And I think that addresses two target demographics. Because if you have, on the one hand, the people who lack a bit of understanding also on medical terms, let's say, and have little experience and are, for example, just diagnosed or aren't even diagnosed yet, you need to get them on board. And on the other hand, you have patients with long-standing disease who have read almost everything and still lack specific answers to specific questions, and integrating that together with their testimonials, which resonate and other patients can relate to. I think that gives a powerful instrument.
And what are your hopes for the portal? How do you think the portal will help patients globally?
Well, on the one hand, it enhances education, and I think that empowers patients, because if you educate them on a basis that they can understand and can follow, so they really get an understanding, and it's not sort of a lecture that has to be completed or just some really complex information that is difficult to sort of structure also in your head and build upon it. I think giving them the power to do that is something that is universal and is applicable to patients globally, and their surrounding society as well. And by doing that, I think it facilitates the access to care, and not necessarily as in that it replaces care, but that it supports the care pathways in general. Because if you have patients who know what to expect and can ask the right questions in that 50-minute consultation with the doctor, I think things can be much more efficient, which is good for their outcomes, which is good for economic outcomes, and also good for the physician and the healthcare providers themselves, that they can work in an as efficient as possible way. And thirdly, well, it promotes best practices, because we work with these world-leading experts and we integrate evidence-based medicine. So promoting that globally, I think, can only help the healthcare system in general and reduce societal and economical burden. That's a bit the goal.
Well, very many congratulations indeed. A huge task. Now, this is all part of a much bigger initiative, isn't it? This is the ADAPT program. What is that exactly?
Exactly. Yeah, the ADAPT program stands for the Airway Disease Action Plan for predictive and preventive treatment. And it's sort of I can't reveal much here, but it is sort of a high-level implementation plan that EUFOREA builds on to address these unmet needs. And it goes quite broad indeed, because it involves general ambition to prevent airway diseases, because as you know, most cases of airway diseases are managed are unmanaged or are managed in primary care. So not all patients have access to specialist care. So we have to attack on several fronts, let's say, and prevent airway diseases requires more investments in primary care efficiency and in understanding, as well as in a faster referral to secondary and tertiary care. And one other front that adapts that we want to contribute to is in secondary tertiary care, to implement more personalized medicine. And for this, we need decisions based on big data that we have.
Zander, always a pleasure. Thank you so much for your time. Dr. Zander Bertels there.
Thank you, David.
Well, there you have it, a really exciting initiative from EUFOREA, the launch of the EUFOREA patient portal on January the 31st, 2025. It promises to be a huge step forward in helping patients to manage their chronic respiratory disease and ultimately will improve patient care globally. Many thanks to my guest, to Dr. Catherine Shah, and also to Dr. Zander Bertels. Now, you can find more information about EUFOREA. You can also register for the EUFOREA educational events on the euphorea.eu website, where you can also sign up to receive the latest news via email. Also, we are on social media. Do please follow us. We're on YouTube, X, LinkedIn, Spotify, Instagram, and of course, Facebook. Until next time, bye-bye.